Hi everyone, I'm Courtney Lawhn Heath. I'm a nuclear radiologist and I'm an assistant professor in the Department of Radiology at UCSF, University of California, San Francisco. And today I'm going to talk about some of the very exciting ways that nuclear medicine and molecular imaging helps us find and evaluate breast cancer in the body. So I have no conflicts of interest, but I do want you to know I'm going to be showing some different imaging technologies, which includes some products, including what we use at my institution, UCSF, but I don't personally endorse any specific product or company. Now, first of all, I did say I was a nuclear radiologist, and I just want to clarify what that means. So, a nuclear radiologist is a radiologist as well as a nuclear medicine physician. So, they're board certified in both specialties. That generally means that after 4 years of medical school, they have done a 5 year radiology residency and a 1 year nuclear medicine fellowship. Now, both radiology and nuclear medicine involve reading medical imaging, but they're pretty different from each other and complementary. So, radiology gives us important information about the structure of the body. So, things like anatomy, where things are, the size of things. And that includes imaging studies like mammograms, ultrasound, and MRI. These are all images of the breast here. And meanwhile, nuclear medicine is primarily interested in information about function. What kind of cells are we dealing with? Do they have a certain kind of receptor on their surface, like, for instance, the estrogen receptor? And how are they working? Examples of nuclear imaging include molecular breast imaging, lymphoscintigraphy, and PET. And these and more are some of the types of imaging that I'm going to go over with you today. So, I've broken down the different areas of molecular imaging into these three categories. The first one is looking for tumor in the breast itself. The next one is looking for lymph nodes so that surgeons can plan their surgeries better. And the next is looking for metastatic disease at the level of the whole body, not just the breast itself, but looking at the whole body for metastatic disease, otherwise known as a tumor that has spread outside of the breast. So let's start with looking at the technologies that let us look at for tumor in the breast itself. But first, I want to show you some mammograms and talk about breast density. This might be a concept that some of you are familiar with, especially if you yourself have dense breasts and live in a state that requires that you be notified about that fact. These are 4 mammograms in 4 different patients. They look super different from each other, right? And actually, all 4 of these mammograms are totally normal. Nothing suspicious. So despite looking so different, they are still all considered normal. And the real difference between them is how dense these different breasts are. A on the far left is primarily fatty tissue. That's considered the least dense type of breast. And D on the far right is primarily what they call glandular tissue. In other words, the glands that make milk make up the majority of the densest kinds of breasts. And then other people fall somewhere in between. And this is all just sort of a normal spectrum. Every person's different, and genetics have a little bit to do with kind of why one person is dense and another person is not. The reason I bring this up is because let's say I take a fake, this is a little like fake image of a tumor here, and let's say I try to hide it in each of these breasts on these mammograms, okay? It's clearly not too hard to find the tumor in a breast that's not dense. We can see it really well, but we put a red circle on it to make it even more obvious, but I don't think you need the red circle to see that. As we start looking at the denser breasts, though, that hypothetical tumor gets harder and harder to see, until finally, when we get to the densest of all, I really don't think we can see it. For people with dense breasts, one very effective alternative way of looking for cancer in the breast is to use molecular imaging. And you can see the tumor in this breast on the molecular imaging picture that is essentially totally hidden on the mammogram. This image is called a positron emission mammogram, or PEM. And just like a regular mammogram, the setup's very similar. The breast is held between 2 paddles, but the nice thing is that unlike a mammogram, there's actually almost no compression. We all know how uncomfortable the compression of a mammogram can be. The compression with PEM is really just enough to sort of keep the breast from moving around when you breathe. So it's much more comfortable than a regular mammogram. So this is a similar setup to yet another type of nuclear imaging technology that's called molecular breast imaging, or MBI. And here's a nice example of this technology where we see the tumor in the breast here, as denoted by the red arrow. And we see it much more clearly than we can on the mammogram. I'm not sure we can really see it on these mammograms. So many of you, here's another technology. Many of you are no doubt familiar with the imaging setup of a breast MRI, right? Where you lie face down and you can see the tumor here in this MRI image in the yellow box. Well, there's a molecular imaging setup that works similarly to MRI so that we can compare the findings on those imaging studies to the MRI scans a little more easily. That technology is called dedicated breast PET. And the images look like this. And this is actually the type of setup that we use at my institution, UCSF. And I want to show you a case actually we had earlier this month that to me really shows the promise of this technology and the value. This is all sort of new stuff here. So this patient just got diagnosed with breast cancer. And the red arrow here shows what her tumor looked like on her breast MRI scan. Now, on that same day, she came in and got a dedicated breast PET scan. But now you can look, a PET scan can show you a bunch of different things. For the scan I'm going to show you, we set it up so it would show us where there are a lot of active estrogen receptors. And we can see a hot spot right where her tumor was on the MRI. And what that told us is that her tumor had a lot of active estrogen receptors. So after these scans, the patient started on a medication that was meant to block those receptors so that hopefully we could stop the tumor from growing. After 3 weeks on that medication, we imaged her again, and her follow-up MRI, really there wasn't too much change. It looked very similar. But interestingly, it completely disappeared on the PET. And what that told us was that the medication was probably doing a very good job of shutting down those estrogen receptors. And what we hope is that in a few more weeks, we'll start to see some differences on the MRI as well. But that perhaps the change in the response to therapy, we're starting to maybe see first on the PET scan. So just to sum up the different technologies that we have in molecular imaging to look at the breast, we have positron emission mammography, molecular breast imaging, and dedicated breast PET. And none of these are meant to replace mammograms by any means or breast MRI scans. Those are all very established and important technologies. But they are very promising tools that can give us complementary information, which is very exciting. The next thing I want to talk about is surgical planning. So obviously, once a breast tumor is diagnosed as breast cancer, many patients are able to have that tumor removed surgically, right? When surgery is done, however, it's really important to check and make sure that the tumor hasn't spread outside the breast. And the first place that it's going to go is going to be into some lymph nodes in the armpit. This is an anatomical illustration of the breast here, and those green ovals there are those lymph nodes I was talking about. Lymph nodes are part of the lymphatic system, which is a part of the immune system that's basically a bunch of lymph nodes connected by these channels that go between the lymph nodes, and it's constantly filtering and draining all the tissues around it, trying to get out all the nasty stuff. And lymph nodes help catch harmful substances in the body that have gotten into the lymphatic system. And there are immune cells that live in the lymph nodes that try to identify and hopefully kill any bad things like bacteria or tumor cells that get into them. So they're kind of like heroic in that way. The lymphatic system is an unsung hero. So let's imagine here that this yellow star is a tumor in the breast. Now, there are different lymph nodes that drain different parts of the body. And actually, every single person has like sort of a different configuration of their lymph nodes. It's totally different from person to person. But for the breast, the lymph node that drains the breast is usually always in the armpit, like I mentioned. But which one? We can see on this illustration how many there are. And actually, in reality, there are even like more than this. This is sort of under showing how many lymph nodes there are. So let's say that this blue lymph node here that I've isolated, that little oval, let's say that that is going to be the node that happens to be the first stop for all the lymphatic fluid that's coming from the breast. Well, if a tumor cell is able to escape from that breast tumor into the lymphatic system, the first thing it's going to encounter is that lymph node. And if the immune system is not able to contain it, tumor cells can then spread from there to the next lymph node down the chain. and then the next lymph node down the chain, and so on and so on. So that first line of defense, that first lymph node draining the breast, is very special, very important. It's called the sentinel lymph node. And it sort of watches over the breast tissue like a sentinel. And it's going to be the first to know when the breast tumor has spread. Now, when the breast tumor is taken out at surgery, the surgeon often will also take out that sentinel lymph node to see if there's any tumor there. It gets examined under a microscope, and if there's no cancer in that node, it turns out that this has been going on since the 70s. And so decades of research has shown that there's a greater than 95% chance that if there's no cancer in the sentinel lymph node, there's no cancer in any of the other lymph nodes either. So those are pretty good odds. I'll take those odds. If there is, on the other hand, cancer in the lymph node, in the sentinel node that was taken out, then more lymph nodes need to be removed from the armpit and checked as well. And so it all really hinges on the status of that sentinel node. Does it have cancer in it or not? But there's just one problem. Like I said, everybody has a slightly different configuration of lymph nodes, and different nodes for different people drain different tissues. And so how are we supposed to know in a given person which one is the sentinel node? Which one does the surgeon take out? You can't tell just by looking at it. So nuclear medicine has a solution for this. So what we do is we inject a very trace amount of a radioactive substance into the breast. And it's either going to be near the tumor or near the nipple. And that substance is going to get filtered into the lymphatic system. And guess where the first stop will be? The sentinel lymph node. So once the patient is in surgery, the surgeon can then use a special probe that can detect that trace amount of radiation that ended up in that sentinel lymph node. So they can easily find it and take it out via a much smaller skin incision too than if they'd had to sort of search blindly for the sentinel lymph node. Now, there are actually some cases where we actually might want to take a picture. We might want to use a scanner to take a picture ahead of time of where that sentinel node is, especially if a patient has already had some lymph nodes removed in that armpit before. There are other reasons too why you might want to take some images ahead of time. This is called lymphoscintigraphy, and I'm going to show you some example images here. The images I'm going to show you here are basically a horizontal cross-section through the chest. Okay, here's the first patient. The patient is lying on their back, and the part of the body that's facing the top of the slide is going to be the breasts. And that yellow hot spot there is the site in the breast where the radioactive tracer was injected. And this yellow hot spot in this image, this is a little bit further up at the level of the armpits, and that yellow hot spot is the sentinel lymph node in the armpit. But it's not always that straightforward. Okay. So here is a patient this patient previously already had all of the lymph nodes in her armpit on that side surgically removed. So we weren't sure where the new sentinel lymph node was going to be. So here I'm showing the injection site here in the breast, and the sentinel lymph node actually ended up being in the armpit on the opposite side. So that was very unusual. Definitely would not have been obvious to the surgeon to look on the opposite side armpit. So imaging here was very, very important to help identify where that sentinel node is ahead of time. The scanner that takes these pictures is called a SPECT scanner. And that trace amount of radioactivity that we injected actually gets picked up by a detector called a gamma camera. And over time, it can make images like this. If we just let the camera sit there and detect the radiation for a few minutes, it makes these two-dimensional images called planar imaging. If instead of letting the camera just sit there, we actually make it rotate around the body like this, we can actually take a three-dimensional picture of the body. And that is how we get cross-sectional views of the body. And like I showed you, they can be very helpful. Okay, so the next area where molecular imaging shines is in looking at the whole body, trying to find metastatic disease or tumor that has spread outside the breast. Here's an example of a normal PET scan. And here's a scan with, unfortunately, a lot of metastatic disease. So how do taking these pictures work? So to start with, we inject something called a radio tracer into the bloodstream. And that's going to help us see if there are tumors anywhere in the body. The most common type of radio tracer is actually just a type of sugar. It's basically just a sugar. And we use sugar because most kinds of tumor cells use a lot of sugar. And we want to kind of be able to catch them in the act of doing that. Now, we could just take sugar water and inject it into the bloodstream. But the problem there is that we would have no way of knowing, once we injected it, where the sugar went once it's inside the body, right? We have no way of seeing that. What we need is some way that we can peek inside the body and actually be able to see where the sugar went in the body. That way we would know where the tumors are. And so what we do is we attach a tiny radioactive atom to the sugar. And then when we inject the sugar, we can see exactly where all the sugar went, right? Because we can take a picture of it using a PET scanner. And like I mentioned, sugar tends to collect where there are tumor cells. And so here's where a PET scanner looks like, empty, and then a person lies on their back in it. It's a sort of a donut hole that a patient lies down inside of. And the PET camera detects the very small amount of radiation in the body, and we end up with a picture of where all the sugar went. But the real power of this kind of imaging comes when we join two things together, and that is a CT scan that shows us where all the different tissues are in the body and kind of what's what, and the PET, which shows us what's happening in those tissues. And that gives us a PET CT, which is a type of sort of hybrid imaging where we're fusing two types of information together, and both are greater than the sum of their parts. So here's an example of what PET can do. I'm going to show you a scan in a patient who was just diagnosed with breast cancer. And the images I'm going to show you are going to be a side view, so sort of like this orientation. So the main thing that you're seeing, the main white thing that you're seeing going down the length of the body is the spinal column. And this was a CT scan, and this scan was normal. In other words, there was no metastatic disease, no tumor outside the breast was seen. However, the PET scan that was done at the same time showed, unfortunately, a very extensive amount of tumor in lots of bones, including the spine, the breastbone, the upper legs. And so we're able to actually see a lot of things with PET that regular imaging can't show us. Here's another example. This time I'm actually going to show you just what's in that little box, just a really small little bit of the lower back. Now, this patient, before starting chemo, got a CT scan, and what it showed was a tumor in one of the vertebral bodies in that spinal column, and that's the white thing that we're seeing in the blue circle. Sure enough, on PET, there was a hot spot in that same location, and what that told us was that this was an active bone metastasis. In other words, active tumor in the bone. After chemotherapy, the patient got imaged again, and the CT scan looked exactly the same, but on the PET scan, it had almost disappeared. We almost can't see it anymore. And so that let us know that there was a response to treatment. And we may not have known this if we'd only gotten the CT scan, because on CT it looked the same. So different kinds of imaging can really help give complementary information. Now, some colleagues at my institution recently did an analysis where they compared regular imaging to molecular imaging for looking at the whole body, for looking for tumor in the whole body in breast cancer patients. And they found that regular imaging had more false positives than PET imaging. Patients had a longer time until they were able to start therapy when they got conventional imaging. And that even though PET imaging is more expensive up front, because there are fewer false positives and shorter time to therapy, the PET scan actually saved money in the long run compared to regular imaging. So those were very interesting findings. But actually, we don't have to confine ourselves to looking at where sugar is going in the body. We can use PET imaging to look at a ton of different things. And one interesting thing that we can do is, instead of sugar, we can use estrogen, and we can actually take pictures of where estrogen is going in the body. Estrogen is just a hormone, and it happens to be a hormone that sometimes can be involved with breast cancer, in estrogen receptor positive breast cancers in particular. And some types of breast cancers are very hard to see on regular imaging or even on the sort of sugar PET, the more common sugar PET, but they can actually be seen very well on this estrogen PET because those tumor cells have a lot of estrogen receptors. One type of breast cancer that can be difficult to see on imaging is lobular breast cancer. So here's a case of a patient with lobular breast cancer, and we didn't see much on the CT. We didn't see much on the sugar PET, but we were actually on the estrogen PET able to see that unfortunately she did have extensive metastatic disease in the bones, and we may not have known about that if we had only looked at the sugar PET. So this estrogen PET radiotracer is a pretty new development in the medical world. It was just FDA approved in 2020 under the brand name Cerianna, and it's something that we're just getting going with at institutions around the country. So I know this has been a whirlwind tour, but I hope that I've been able to convey to you the usefulness of molecular imaging in breast cancer and all the different fascinating technologies that we have at our disposal to help find this disease and treat it better. Thank you so much for your attention, and thank you so much to SNMI for letting me be a part of this event.